Six years ago, in Critical Hospital, Mr. Sopan Gaikwad was admitted with a severe heart attack. He took us 10 to 12 days to save his life, after which we sent him to a major hospital for angiography. On angiography table, he was told that he has to undergo surgery immediately or within 10 days he will die. He had to arrange for 2 lakhs rupees immediately. His children were not settled. Moreover, he had a fear. His uncle had also died of the complications of surgery. Because of this, he was desperately seeking a way of recovery without surgery. This episode shook my inner conscience, and then I got inspired to choose my goal of prevention of heart diseases. I had rehabilitated him in a period of 6 months using the principles of reversing heart diseases through lifestyle changes and medications. He is now walking for almost 7 to 8 kilometers a day, lives a normal happy life. As per the WHO statistics, maximum number of cardiac deaths, that is 60%, is going to be in India. Every fourth Indian is going to be affected by this fatal disease which culminates into heart attack or sudden death. Why are this increasing number of high-tech heart hospitals not able to control the increasing number of heart patients? The answer is simple. Prevention is the only vaccination. To spread this message to millions of Indians, we founded Institute of Preventive Cardiology, where we have trained over 50,000 people on the zero heart attack path, and 1500 critical heart patients who had been advised surgeries were successfully cured. So dear friends, let's not break our heart. Let's know more about our heart and save it from an attack. Heart is the most important and powerful organ of this circulatory system. Heart is situated in the middle of the chest, slightly towards the left. It is about the size of a fist, weighing 250 to 300 grams. It beats 60 to 72 times per minute, almost 1 lakh times a day. Let us technically understand how this heart beats. In our heart, we have been given 4 chambers, 2 upper chambers known as auricles and 2 lower chambers known as ventricles. The impure blood from the entire body is taken to the right upper chamber of the heart, and through the tricuspid valve it goes below in the lower chamber, the ventricle. From there it is pumped to the lungs for oxygen. The oxygen rich blood comes to the left side of the heart, the upper chamber, and from the mitral valve it is pumped into the lower chamber. From here it is pumped to the entire body through the main pipe, which is known as the aorta. This entire process constitutes one heart beat. The heart, which is a pump, supplies 5 liters of blood to the entire body, but it cannot take away this 5 liters for itself. It receives its blood supply from the 3 main arteries, which are known as coronary arteries. There is one on the right side, which is known as right coronary artery, and 2 on the left side, one which supplies the front part, which is known as left anterior descending, and one which supplies the back part of the heart, which is left circumflex. These 3 main coronary arteries supply oxygen rich blood to the heart, and because of this the muscles are able to pump blood to the entire body. Now when the doctors say that there is a choke up or a blockage, what do we mean? The fat deposits which occur in these arteries of the heart is known as coronary artery disease, which can lead to pain in the chest, which is commonly known as angina pain or angina pectoris by the doctors. Sometimes this blood supply suddenly stops and a person can get heart attack. Some people don't get any of these things, and 25% of the people experience sudden cardiac deaths. Such is this deadly disease known as coronary artery disease, which constitutes almost 85% of all the heart disease, and it is largely preventable. Technically, these blockages are known as plaques, which form on the arterial walls, and they make the arteries hard and narrow. Now let us understand how do these plaques build up. Our arteries are smooth and flexible and supple. It is basically muscular. It has a covering which is smooth lining known as endothelium. Let us compare it with a non-stick cooking pan which has a Teflon coating. If this coating is removed or gets disturbed, food particles stick on it. Similarly, in our body, when this arterial lining starts getting damaged, these fatty cells start getting deposited. Unfortunately, nowadays in our food, water and air supply, there are a lot of toxins which cause a biological reaction, that is a free radical damage, which damages the internal lining of the arteries. If you will observe, the blockages development process is a natural healing process taken up by our immune system. When this damage takes place, the fat cells, blood clots, calcium, they all rush to seal that disruptment in the lining of the arteries and try to form a scab, and then it becomes hardened through the fibrous material. All this blockage development process narrows and hardens the coronary arteries, and the heart is silently compensating. When these blockages cross 70% mark, then the shortage of blood supply becomes too much, and then a person starts throwing symptoms of chest pain. When this blockage becomes 100%, then suddenly heart attack sets in. The patient experiences severe chest pain as if some elephant has put a foot on his chest. Some people start perspiring, all their clothes are wet. Some people even experiencing nausea, vomiting, loose motions. But many times people think that this cannot happen to me. They often delay, and you would be surprised to know that almost 50% of the people die if they don't receive proper treatment during their first heart attack. It means time is important. Time is muscle. That is, if you get prompt treatment in the first 1 hour, as soon as you get these symptoms, your heart can be saved. So, dear friends, you have learned about the blockages in heart attack, but I want to mention of a special group that nowadays we have a lot of young adults coming up with heart attack. What happens in such cases? We see 26-year-old getting heart attack, and when we do an angiogram, there are no blockages. What goes wrong? Whenever there is acute stress, the artery goes into sudden spasm, that is constriction, and it temporarily cuts off the blood supply and a large clot is formed. This could also be the reason of heart attack. So now let us understand that since when these blockages start developing, at what age. Now if you look at this picture of coronary arteries, you will see at birth we are born with clear pipes, and as we grow older, then these blockages develop. This process begins from teenage. Heart disease is a silent disease. All these blockages are developing within us, and when you are not even aware about it. But prevention is possible if we can correct our lifestyle and know the factors which cause the disease. Then, as we see in this picture, the way the blockages are deposited, in the similar manner the blockages can also be reduced, and that is what we call reversing heart diseases. Non-modifiable factors are the factors which we cannot change. For example, if a person has a strong family history of having a heart problem, he is more likely to develop this, especially in parents, brothers or sisters before the age of 60 years. The most commonest factor which is related to our diet, especially high cholesterol and triglycerides. This leads to the fat deposition in the blockages. Secondly, high blood pressure and diabetes, they also damage the internal lining. Many people know that smoking relates to cancer, But people don't know that smoking also can cause heart attack. Tobacco chewing, gutka, lack of exercise, obesity, these are all the factors which can lead to the development of blockages. Nowadays, you must have heard a common phenomenon. A simple man having no cholesterol, no blood pressure, no diabetes, no bad habits, exercising, but still gets an heart attack. How is that? Dear friends, stress. Stress causes the coronary arteries to contract and reduce the blood flow to the heart. Stress is also one of the important reasons which causes heart attack. Hence, stress management becomes very important to prevent a heart problem. Somebody climbs a railway bridge. On climbing up, there is heaviness in the chest, and when he sits on the platform, he feels better. When somebody goes for a morning walk, after walking for 5 minutes, there is heaviness in the chest which may spread to the left arm or to the right arm or behind in the back. Sometimes some may experience even in the jaws. Some people after eating food feel heaviness in the chest, there is burning pain, and they often say it is because of acidity or gas. How many of you, when you come back home, feel fresh and energetic after your office work? If you are feeling fatigue and which is excessive, it could be a symptom of a heart problem. Let us begin with few blood tests like cholesterol test, lipid profile, blood sugars, stress test, 2D echo, ECG, stress thallium, angiography, cartography. We at IPC have introduced cartography, which is the latest equipment from Europe, which in 5 minutes lets us know about the complete function of the heart. The people who have been advised angiography or a surgery, who have undergone bypass and angioplasty, can also do cartography to evaluate whether the grafts or stents are working properly or not, so that we can prevent reoccurrences in them. Thus, cartography is applicable to one and all, as it is non-invasive and very cost effective. Once a patient is diagnosed to have a heart problem, the initial reaction is shock, fear and grief. He has various options of surgical and non-surgical treatments. The most important and the first option which is generally given is that of a bypass surgery or an angioplasty. What is angioplasty? The catheter which is guided through the artery up to the heart is taken right up to the blockage. Then a balloon is inflated which reduces the blockage. Then slowly a stent is introduced which makes the blockage stable and to prevent the recurrence. If there are multiple blockages and angioplasty cannot be done, then generally a open heart surgery or a bypass surgery is advised. What do we do in this procedure? The entire middle bone, that is a sternum in the chest, is cut open, stretched apart, and the heart is exposed. There are arteries which are taken up from the hands or the veins from the feet, or something which is there internally is taken and stitched. Nothing is done to the blockage, just from the top to the bottom, wherever the blockage is, the graft is stitched. So again, what do we see? 10% of reblockages every year. Thus, in 9 to 10 years, the blocks come back. As I have seen in my practice, more than 50% of my patients are the ones who have already undergone bypass or angioplasty. When heart patients are recommended immediate bypass surgery or angioplasty, the first thing which comes to their mind is, can I avoid it? And then they come to IPC to seek a solution. Dr. Dean Ornish, a famous cardiologist who has also conducted these programs of reversing heart disease, has done research trials from last 20 years and has proved beyond doubt that through simple essential lifestyle changes and allopathic medications, one can definitely reverse heart diseases. To recommend our patients, first and foremost is ECP, that is Enhanced External Counterpulsation Technique. In this technique, the patient lies down on the bed and the cuffs are tied around his thighs and legs. Like we inflate the blood pressure cuff, similarly these cuffs are also inflated and deflated. During this process, a counter pulse is generated and this increases the pressure in the coronary arteries. The result is natural bypass. During this EECP treatment, they get activated and they open up and they are there permanently. Thus, within 1 hour of sittings daily, in 1 month, the patient comes back to normal life without any cuts, pains or anesthesia. Another important treatment which we give is arterial clearance therapy. In this non-operative treatment, without any anesthesia or any hospitalization, we call the patients twice a week for 3 to 4 hours. During these sessions, they are injected injections through intravenous drips which reduce the blockages and improve the blood flow to the heart. Thus, without doing bypass surgery or angioplasty, we ensure that our patient starts leading a normal life. Let us understand what are the different kinds of foods which we should incorporate in our day-to-day diets and what are the foods which are to be avoided. The most important constituent of food is carbohydrates, which provides almost 75 to 80% of our energy requirements. Mainly the wheat, the unpolished rice, poha, the puffed rice or kurmura, rava, all this should be incorporated in our daily diet. Even the smaller millets like the jawar, bajra, nachni or ragi, they are also equally important and should be taken. Let us now see the refined carbohydrates, mainly what we use in our day-to-day food, which is the maida. This does not have vitamins, fibers or minerals and it is mainly empty calories. And nowadays we are seeing increasing consumption of white bread, pizzas, burgers, all these items which just increase the number of calories and don't give us nutrients. The simple carbohydrates like sugars, jams, jellies which provide instant sugars should also be avoided. Now what we talk over here is the replacement or modifications in diet. Like routinely what we have, the white bread, nowadays even brown bread is available which is high in fiber and the vitamins and nutrients. Like there are digestive fiber biscuits which are available. Otherwise usually the routine biscuits are made up of maida, that is the refined carbohydrates, which are again empty calories. So we can make our day-to-day food which is more nutritious and more healthy. The wheat flakes which are there in early morning breakfast time can be taken, and our routine flour, that is the atta which we use, can be mixed with the wheat bran which will also increase the fiber content. Fiber is very important as it helps to lower cholesterol and it also solves the problem of constipation. The different fruits, vegetables and salads what we can incorporate in our diet. This what you can see over here, the cucumber, the tomatoes, broccoli, carrots, all this they are recommended in our daily diet because they are rich sources of different vitamins, that is mainly your vitamin B, vitamin C, vitamin A, vitamin E. These are the different vitamins what we call antioxidants which helps us to prevent the problem and also very important for heart patients who have already got the blockages. Also we talk of fruits, and at least 2 to 4 servings of fruits is also very important in our day-to-day diet. The people who have got diabetes should avoid very sweet fruits like chiku and all, so that otherwise it will increase the sugar levels. Otherwise the people who don't have any health problem can incorporate any amount of fruits in their diet. And even research has shown that dry fruits are also very important, and in fact certain dry fruits like an apricot helps us to lower cholesterol. For normal people we recommend 4 to 6 apricots which can be soaked in milk and have for the breakfast. It is very good. We also talk of walnuts which helps to lower cholesterol. Even black raisins soak overnight in the water, and in the morning 4 to 6 raisins can be had, and even almonds are also very good. All these dry fruits help to lower cholesterol and can be incorporated in our day-to-day diet. Proteins are mainly the bodybuilding forces in our body. Proteins are important in children especially because it is the growing years, and here as you can see the different kinds of dals, the green chana, the brown chana, the chole, all these things are important sources of energy. especially if you soak it overnight and if you sprout them, then they become more nutritious because there is increased content of vitamin B and vitamin C. The different kinds of juices which one can have, especially the carrot juice, the anar juice and the dudhi juice. These are the three important juices which research has proved as important sources of antioxidants, and if they are incorporated into daily diet can definitely help prevent a heart problem. If you look here, these are the alsi seeds or known as the flex seeds. These have omega fatty acids which help to lower cholesterol. We also recommend methi seeds on a daily basis which are soaked overnight. Even 2 to 4 cloves of garlics help to reduce the cholesterol. Half raw onion daily, and even til is also good. So all these things help to reduce the cholesterol. Also we recommend in vegetables the gawar phali, what is there, even 10 to 15 pieces of that daily helps to reduce the cholesterol. The last group which we have to deal is about fats. Fats also provide us energy, and if we will see that in the diets which we generally recommend, we say that only 10% of your energy should come from fat. Generally MUFA based oil, that is mono unsaturated fatty acids, mainly the olive oil, double filtered groundnut oil or til oil are generally recommended. Let us see what are the common food items which we use which are not good for the heart. Now in the eggs, the yellow part has got very high amounts of cholesterol. One single egg the egg yellow has got around 300 milligrams of cholesterol. This, if we want to eat the eggs, we have to remove the yellow part and eat the white part. This is good as it helps us to get good amount of proteins. So egg white can be safely had without the yellow part. We see the different fried items which we take for our snacks which could be avoided, like the sev and the puri and the chakli and all those things. Now we are not asking to absolutely cut off all these things. There are a lot of modifications available nowadays. Like if you want to have pani puri, you can have baked puris. You want to have sev puri, you can have baked puri, and you can add all those vegetables and ingredients over it. Mainly if we look into papads and pickle, they have a lot of salt amount in it. Salt intake becomes very high, which leads to high blood pressure, that we call hypertension, and again an increased workload on the heart. Hence this kind of items should be avoided. Also nowadays we see increased consumption of these noodle based items which are supposed to be the fast food, quick foods, but again they have all this maida, that is refined carbohydrates and preservatives, which are again not good for the heart. So one should keep in mind that if they avoid this kind of foods, they are preventing a heart problem. Also there are different kinds of butters or low fat butters which are available if one feels like eating at times, but generally butter or cheese, all these things should be avoided as it contains high amount of fats. After understanding the importance of diet in prevention and treatment of heart problems, now let us focus into exercise, which is another equally important aspect in prevention of heart problem. Okay, so keep your knees equidistant from the ground. Okay, palms on your knees, back straight, close your eyes, focus on your breathing, slowly open your eyes, hands by the sides, slowly breathing in, raise your hands up, close your eyes, join your hands, stretch, slowly breathing out, your hand goes down, breathing out. Now we will do forward bending. Close your eyes, breathing out, bend towards your right knee, let your shoulders relax, breathing in, come up, breathing out, go towards your left side, breathing in, slowly come up, and now we will do alternate nostril breathing. So block your left nostril, breathe in through the right, close the right, breathe out through the left. Okay, then you again have to breathe in and breathe out. This is one cycle. All of you lie on your stomach, lie flat, arms at the level of shoulders, Yes. Nose touching the ground. Slowly breathing in, raise up. Eyes looking at the sky. Stretch yourself, get the stretch on the upper back. Slowly breathing out, go down. Slowly breathing out, go down. Relax. Okay, now see, what we do is the 1 feet distance, okay? Feet are parallel to the ground. Breathing in, we raise our hands and raise our heels. And breathing out, hands go down and heels go down. Breathing in, hands go up, go down, very good. Breathing in, and hands go down, heels go down. So breathing in, raise your hands, twist towards your right, focus on your nails. Again come back in the front, come back slowly in the front. Go towards your left, go towards your left. Breathing in, come up, hands down. We'll raise up the right hand. And then opposite side. Heart attack is like an earthquake. It takes years in making and strikes suddenly one day without any warning. Yet, unlike an earthquake, heart attack is preventable. So dear friends, let's attack the heart attack before it attacks you. I am here to awaken you, inspire you on this path of prevention. Simple preventive measures which have been discussed over here should become a part of your daily life, which will not only save you but all your near and dear ones. Dear friends, we need your help. Let's take a promise to ourselves to save our heart from today onwards, from just now, and say bye-bye to heart attack and bye-bye to bypass surgeries.